Hi, I am Dr. Steve Allen, and I'm a trauma and acute care surgeon at MU Healthcare. So an acute care surgeon not only does trauma resuscitations and takes care of injured patients, but also takes care of patients who have emergent surgical needs, whether it's a small bowel obstruction, appendicitis, cholecystitis, any number of acute general surgical issues. I really love to do and train for Ironman and half Ironman distance triathlons. When I'm not doing that, I enjoy doing track days in various cars and driving fast. Being a trauma surgeon was a natural fit. I realized that between the atmosphere of the operating room and the actual intensity of the procedures, it was something that I was going to pursue without a question. You never knew what was going to come in terms of the injuries or what surgeries I'd be doing that day. I really loved the unpredictability and knowing that it was going to be something different every single day. I think the most rewarding thing about my practice is taking care of patients in the most dire times of their need. You know, these patients wake up, they eat breakfast, they go to work, they're in a terrible car crash, and I get to render care that will hopefully save their life, but also work with them and their families as they work through their recovery. I think my greatest strength is my compassion and empathy. I really try to apply that in the trauma bay as I'm resuscitating somebody, but really more importantly, after we perform an operation or any sort of intervention. I think my bedside manner and my ability to work with the patient and their families is really what is my strength. The most important piece of a doctor-patient relationship is really garnering their trust so that they know that any decision you're making is in their best interest. So, and also incorporating their families so that the family not only knows what's going on, but so that they understand the decisions that we're making. I really try to take care of my patients as if they're a family member or a friend of mine. I try to advocate for them. I try to make sure that the family knows that they can advocate for them and should advocate for them, and really to apply strong, compassionate care anytime I'm taking care of somebody.